Hello, everybody, and welcome back. I'm Dr. Patrick Fox of Expat Health Code and joined by Tanya Rodriguez and Vashti Kanakili, our founding health coaches of Expat Health Code. And we wanted to come on today and discuss this rather large topic of community and kind of the importance of it from multiple different angles as being an expat, and then also kind of some examples that we've had in our lives as expats and in our history. So, community, what I tell all of my patients, and you will hear it from me too, is that healing happens in community. It's really difficult as these biological creatures that we are to heal without the support of others around us. It doesn't necessarily mean support only in one way. That can show up in so many different ways. It can be loved ones, it can be our healthcare providers, it can be people on an online forum that just help drive this deeper connection than just people in your physical environment or surrounding. And so my example really kind of stems from, being an Army bred and growing up, moving and really picking up and establishing a community within, a couple of months. It was a little bit easier as a kiddo, but in later into my adult years, it also became more difficult when you have to pick up and move every 2 years. And so your community changes. It changes in a sense of who you spend your time with, how you fill your days, the things that you become passionate about, are interested in. All of those pieces are supremely important, not just for our physical health, but also our mental, emotional health and our spiritual health too. At Expat Health Code, we really look at health as a spectrum, and that's part of this process, is really recognizing that healing happens in all of those spheres. And so by using community and leveraging your community, you can actually see an advancement in your own health of yourself, but also in those of your community members too. And so I wanted to pass this ball over to Tanya and Vashti and see if they have a really good example to talk about that.
Yeah, so for sure, I have a very unfortunate example, a personal experience. When I was living in Switzerland not so long ago, I had to have a hip replacement surgery, which unfortunately went a little bit wrong. And I woke up paralyzed. And it was right about the same time that my partner got a new job and moved to the UAE, the United Arab Emirates. And so not really being able to get around myself, but being left alone to kind of fend for myself in this paralyzed state was really hard. But what I valued most, which I am so grateful for, were my colleagues at that time. And actually my gym instructor. They realized that I was in quite a pickle and everyone just stepped up. So when it came to buying groceries for me, because I couldn't lift any heavy bags, I couldn't walk with anything. Anytime I needed to get to the hospital, my colleagues would drive me there. And so I really like what you said, Dr. Fox, about the sense of community. It doesn't have to be a family member or a blood relative. It can be absolutely anyone in your environment, someone who cares enough to just ask you how you are. And I find that so important, not only for the physical healing and the physical needs that I had, but just for the mental, emotional side of things and my state of mind. They kept me positive at a time where things were really, really sad for me and really difficult. And I value that so much. So yeah, my healing, I think, wouldn't have been what it was if it weren't for them. How about yourself, Ash?
Thanks, Tanya. Yeah, I had a similar, very different, but similar experience in that my husband and I were having a really hard time maintaining pregnancies. And so I had gone through several miscarriages when we were living in Beirut, and I was miscarrying, and he got called away to a different post for a while. So I was there by myself, and it was a really difficult time because for me, it was always like, what's wrong with me? Why does this keep happening? And I was really down in a very sort of dark space. And it was the people around us, our community there, we were a very tight knit group of people, and they would visit me like, morning, evening. One of my closest friends, who's now still one of my dearest friends, would stay the night with me, and they were there. And I feel like very much like you, but that if I hadn't had those people, my healing would not have gone the way that it did, and that I was able to then, work with a doctor. We figured out what was going on and to move forward. But it was those people and that community that helped me through a very, very difficult time, mental, emotional, all of it. And friends for life. And I think that's part of why we're we have this community too, is that we've all had to move from one place to another, make new friends. And sometimes those people stay with you and sometimes they don't, and that's okay. But it's those people in that moment that help you get through the challenges of being an expat. That's what's really important, and why we created one of the key tenets of expat health community is this idea of community, a safe space where everyone is heard and seen, and they know that they're not alone.
I love that. That's, I mean, way to nail it. Just hit the nail on the head there. And again, everybody, we would love to hear about your sense of community, the communities in your areas, things, places you found support. And we will link this in all sorts of social media places. But this is Dr. Fox signing off for the rest of the team with Expat Health Code. We'll see y'all later.